According to the CDC, one person dies from cardiovascular disease every 34 seconds. That's a lot. We welcome cardiologist Dr. Jane Morgan to help us recognize some early signs we should be paying attention to. Thank you so much for being here.
Love being here, Amber. Thank you.
That is a crazy...
We're talking about my favorite subject.
Well, we're glad you're here because that's a crazy statistic.
It is a crazy
statistic.
statistic.
That's a lot.
It's a crazy statistic for most people to not even be aware of it.
Yeah, I think we think there's so many other things that we should be worried about.
That's right.
And especially women, we know we have a tendency to think all the cancers.
That's right.
But it's right here where it's happening.
That's right. It's behind the breast. It's not the breast.
There you
right?
go.
We focus on our mammograms and our pap smears, which we should. And we've actually been very successful in driving down the rates, especially of death of breast cancer and cervical cancer with the HPV vaccine has almost, gone down to 7%.
It's amazing.
But the fact of the matter is, it's what's sitting behind the breast that's the number one
Yes.
killer of women, and we just ignore it. It's our heart.
Well, and a lot of it has to do that the symptoms we don't even recognize before it's too late. We know that the chest pain, and that's the automatic first thing you always think, but there's so many other little signs saying something's not right.
There are so many other signs, and listen, it's not your fault, it's not my fault, it's not anybody's fault that we don't know them.
Right.
Doctors don't even address them. You know why? Because we use this little word called atypical. That's how we describe cardiac symptoms that more often are attributed to women. That's actually how we are taught. This is a technical term.
Wow.
This is a code for reimbursement for admissions. Atypical chest pain. Now imagine when you use the word atypical. What does that mean?
Yeah,
Does
exactly.
it drive inaction or action as opposed to classic cardiac symptoms? Who's going directly to the cardiac cath lab and getting their artery open?
Right,
And who's going to
exactly.
sit and wait and really be triaged to lower levels of care and concern? So what are some of the symptoms? Sometimes women just, feel tired, have a little fatigue, you have like flu-like symptoms, you can't really shake. You wake up tired. You haven't even started your day. You're tired before you're even getting out of the bed. Back pain, jaw pain. I am really working hard to bring my dentist friends in.
We know
with
the
jaw
correlation
pain.
with
That's
so
right.
much of your gums, so it would only make sense that it's right there and it's that close to your heart.
It's that close to your heart. It's referred pain in your jaw. Most of the time, women will see a dentist who may or may not find anything wrong with the mouth and send them on their way. And, we need to be sending those women, especially at midlife, especially between the ages of like 37 and 57, those women need to go to the emergency room, not the dentist's office. And if they end up in the dentist chair, the dentist then
Needs to send
needs to be
them.
a part of the system and segue and say, hey, here's what you need to do from here.
Now, how much pain are we talking? Because all over social media right now, and I've suffered from TMJ my entire life, diagnosed TMJ, but that's what everybody now thinks they have. Do you think a little more of that is heart?
So it's not TMJ, it's more of like an aching, a referred,
Like
something
a
that comes and
tooth
goes.
pain.
That's right.
Okay.
That's right.
That's
And that's
good
why
to
it's
know.
more often confused. And you say, oh my God, I need to, get a
Right,
root canal, or I
right.
need to go check with my dentist.
And go to the
Nobody
cardiologist.
thinks, who would think? My jaw. Oh, I must be having a heart attack. And that makes sense that we wouldn't think it, but we also don't think it because we're not taught it.
No, not at
Right.
all. Not at all. Now,
Right.
how much time do we have once we have a pain like that? Our dentist realizes that it's not our teeth, it's our heart.
Right.
Is that just kind of a warning sign, or is that a sign that it's actually happening?
Yeah, it's a sign that it's actually happening, that your heart is under strain, that you have less oxygen being fed to the cardiac cells.
That's scary.
And that's scary. And women have a 37-minute delay in receiving treatment. That's on average. And every minute counts when we're talking
Yes.
about a heart attack. 37 minutes is an eternity
Absolutely.
to delay. And you think there's some women who actually have heart attacks at home. They just weren't feeling well. They stayed in bed for a few days or even a week or two, and then they finally started to feel better. The fact of the matter is they had a heart attack and survived and didn't know. And more often we will see women present for a normal physical exam or for some other reason, and we get an EKG and we say, oh, Mrs. Jones, when did you have a heart attack? She's like, what? I had a heart attack?
Wow.
Right. So it's really insane.
So you wouldn't know, and I was going to ask you, how do you as a doctor see? So it shows up on the EKG and
You
the
can
history.
see it on the EKG if someone's men or women. If you've had a previous heart attack, we can see it on the EKG in a number of ways. Oftentimes it's what we call Q waves and things. Yeah.
Now, once you've had one, are you more prone to have another one in the future?
You certainly are if, one, you're a woman, two, you're midlife, perimenopause and menopause, where you're losing the protective protection of estrogen, and three, you're unaware of it, so you haven't been put on any medications to help protect you from a next heart attack. So absolutely. And who falls into that category more often? Women.
Of course.
It's one of the reasons why the first heart attack of a woman is more often fatal than the first heart attack of a man. Delay in recognition, dismissal, don't understand the symptoms, not getting appropriate therapy after the heart attack. How can you? You didn't know you had a heart attack.
Of course, you have no idea.
That's right.
And you had no idea it was even happening, because I'm thinking fatigue is just normal in everyday life.
Right.
It's like,
Of course.
how do you know what that fine line is?
Imagine the sandwich generation that we're in. Women often are in the role of caregivers. So we're taking care of our children, we're taking care of our spouses, we're also taking care of aging parents. You're doing a lot of things. You've got a full-time career. Many times, especially at midlife, women in their 40s and 50s are really reaching the peak of their career, the peak of their power in their careers. And you've got all of these other things happening. Of course, you have a million reasons to be fatigued.
It's
so if
scary.
you start to be tired, you're not going to think, oh, I have a heart attack. You're going to think, it's my parents, it's my kids, it's my job. It's
so
my
many other
right,
things.
Exactly.
Oh my gosh, a lot to think about. I think the best thing is to go and talk to our doctor and figure things out and get everything checked. Thank you so much for being here today.
Welcome. Thanks,
making us
Amber.
aware of things we wouldn't even think about, especially as women. And of course,
don't.
well, yeah, thank you. We'll share this info on BloomTampaBay.com. Bloom will be right back.